We have with us and Dr. Paul Ihuriona in the studio, and he's actually a pediatrician, right? A consultant in the University of Benin Teaching Hospital. Good morning to you, sir.
Good morning, Frank and Ewa.
Good morning, sir.
And it's great to have you in the studio this morning.
Nice being here too.
Yeah. So, and I think I've been trying to get Dr. Paul for the longest time since last year, and I'm grateful that we're able to have him right here in the studio. Yeah, you can call him the big elephant in the room right now. So it's great to have you right here, sir.
Yeah.
So we'll just delve into our conversations this morning, and we're looking at autism. And can you tell us what is autism and what are the misconceptions concerning autism in layman's understanding?
Layman's understanding, I think that's where the work is. Well, let me make an attempt. Autism is a developmental disorder. It's meaning that it's a disorder that affects a child's development. And in layman's language, you say autism is a developmental disorder that has certain characteristics. One of them is that there is impairment of communication and language. Two, there is impairment of socialization. The most recent DSM, Diagnostic Statistical Manual, puts those two together. So they'll say is impairment of social communication. But they also have some restricted and repetitive behavior. So for the sake of understanding, we'll say they have communication problem, they have socialization problem, and they have certain behaviors that are a little bit restricted and repetitive.
So what would be the misconceptions that a lot of persons do have about autism?
Well, autism misconceptions have been from way back. Once upon a time, people thought it was the same thing as intellectual disability or mental retardation. But it took a while to clear all that out, and now people see a child who has communication impairment and say, don't worry, he will outgrow it.
Okay.
Oh, some children don't talk on time. Oh, that's how it is for some people. In fact, more interestingly, they'll say it's tongue tie. Go and cut the tongue and he will start talking and all of that. And so people just think, okay, maybe it's a funny child or it's a special child or something. I think what we have, rather than misconceptions, are more of ignorance. People really don't know anything about autism, and so they fill in the ignorance with just assumptions.
Okay. So what are the early signs of autism? When should parents or guardians be concerned about their infant if they notice this behavioral changes?
Okay. Well, generally, we say because it's a developmental problem, if your child is not acquiring developmental competence at an appropriate age, you should be concerned. So if a child does not sit when he's expected to sit, you should be concerned. But more specific to autism, one of the major concerns for parents whose children have autism is the language and the communication skills.
Okay.
So we have a few trends. The most common trend is a child who developed language skills appropriately, say till around 1 year, 3 months, and after which he begins to lose his language competences. That's the most common presentation. Why there are a few who do not even develop language or communication skills appropriately. Then there are a few others who develop language and communication skills appropriately. Somewhere around 15 to 18 months, they plateau as if they did not progress beyond there. So it's a spectrum, but anytime you think that your child's developmental competence, especially in the 3 areas I have mentioned, communication, socialization, and repetitive restricted behavior, is halted, then you should be concerned. One other interesting feature is that because they have socialization deficit, they tend to be socially withdrawn. They tend to just like to play alone, be on their own. They do not interact with other children, vis-a-vis their communication deficit. Most parents will assume that, because he's having communication deficit, that's why he's not socializing. But the socialization deficit in itself, it's quite a major deficit apart from the communication deficit. I mean, there are children who do not talk, but they socialize well with others. But for the autistic child, apart from the challenge with communication, he would also have limited competence with socialization.
Okay, so in all of this, how do we classify the different levels of this autism spectrum? How do we draw the levels, the differences in all of them?
That's a difficult question. So maybe a couple of years ago, I would have given you different classification.
Okay.
And that's when they had things like autism, Asperger's disease, and the others. But more currently, autism is being understood to be a spectrum. And any child can be in any part of the spectrum. It's a wide spectrum. Someone can have significant limitations and he's autistic, and someone could have mild limitations and he's autistic. So we are no longer in the business of putting them into boxes like this is. Some people still talk about mild autism and severe autism, but we just generally say we think he's somewhere in the spectrum. We may be able to define the degree of limitations, but autism spectrum disease is autism.
Okay. All right, so moving on. How is autism typically diagnosed in Nigeria? Like, what are the processes involved, and what specialists are usually consulted? For instance, someone's child is autistic, and she's like, I don't know where to go to. I don't know the specialist to consult to. Can you actually throw more light on that?
Okay, so several people may help with diagnosing autism. So let me just stay on diagnosing a child with developmental problem. I'll tie it up with autism. So the easiest way to diagnose a child with developmental problem, or to suspect that a child has developmental problem, is to compare him with his peers. If there is a deviation from the typically developing child, then you should seek the advice of a specialist. So if we talk about an autistic child, we're saying his language competencies, are they at par with his peers, or he seems to be limited? His socialization competence, are they at the same level with his peers, or he's limited? And vis-a-vis certain hand mannerisms that we call stereotypies. That's general, that's like surveillance. And teachers could do this, parents could do this, people in the community could do this. I mean, neighbors could come in and say, I think this child is withdrawn. Yeah. Maybe you should pay attention to it. That's level one. Level two is screening. Screening is not typically done in this part of the world. In more organized climes, by 18 months, a child will be screened for autism. So screening is like using a checklist to ask a couple of questions, and depending on how many questions you answer yes and no to, they are able to screen and say, okay, there's significant risk for autism, or well, there's no significant risk. So in more organized climes, 18 months a child would be, at 18 months he will be screened for autism. At 24 months, a repeat screening will be done. And that's typically done at the child welfare clinic or the well baby clinic. Beyond screening, then there's the diagnosis or the diagnostic evaluation. That it's usually done. May I mention that screening can also be done by healthcare professionals that are not necessarily doctor. So a nurse could apply it, or a therapist could apply it. Beyond that is the diagnostic evaluation, which must be done by an expert. Typically would be done by either a pediatric neurologist or a developmental pediatrician, or a therapist. A speech therapist could also apply the developmental evaluation. Apart from just applying the tool, which is the commonest example is the autism diagnostic interview. It has a set of questions you ask and you make a diagnosis. Apart from just applying the tool, there are mimics, there are differentials. So you will screen out the differentials. And autism comes with a lot of comorbid conditions. By comorbid, I mean co-occurring conditions. So autism may not necessarily be a standalone. It may have epilepsy with it. It may have some behavioral problems with it. It may also have many other developmental problems alongside the autism, which must be diagnosed also and managed. And sometimes those comorbid conditions are more significant challenges to the child than even the autism itself.
Pretty informing right here. And some time ago, there's this debate, so I'll need to put it out to you. There's this debate about what actually causes autism, what leads to autism, why some talk about vaccination, some talk about delay in mothers giving birth and all of that. You are a pediatric neurologist, and it's a specialty for you. I'll need you to clear the air on what actually is known as a cause to autism?
Okay, so for cause of autism, there are many speculations. People have said several things. However, the most consistent and that have been proven is genetic, that autism has a genetic cause. When I say genetic, I mean that the problem is at the level of the gene. So there are a few what we call mutations. There are a few problems at the level of the gene that may predispose a child to autism. However, there seems to also be some familiar tendencies. By familiar tendencies, I mean the general risk of autism in the society is about 0.5%. However, if someone has a child, a brother, if you have a child with autism, the risk for having a second child with autism is about 10%. That's 20 times the general risk in the society. And if you have two children with autism, the risk for having another child with autism is about 25%. So there's some familiar tendencies. But on the issues of perinatal events, like events that occur at birth, or on the issues of vaccinations or diet, or some people have talked about coke and additives to food, no consistent evidence have been found. Most of them are just associations. But because you call that vaccine, let me speak to the vaccine issue. The typical age at which the early signs of autism become obvious is around 15 months, somewhere between 12 and 15 months. That seems to be the age when certain vaccines are taken. So, I mean, to the black man, you cannot just say there's no cause, because that's the age he took vaccine and that's the age autism occur.
Yeah.
People now say it's the vaccine that causes, but there are several other people who took those vaccines that didn't come down with autism. So there are many associations, and most of them have been debunked by research and science. So what is most consistent is genetic predisposition. But however, there are a few other developmental problems that may be caused by perinatal events. When I say perinatal events, I mean, for example, if a child does not cry well at birth, that could lead to some other developmental problems. Some of them may even just resemble autism, but may not be autism. Like if a child has significant jaundice, it could lead to some developmental problems. And most developmental problems just look alike, but autism is quite an interesting, specific entity that must get its attention and must be managed early if you want to get the best results.
Okay, do you think that the number of autistic patients have increased as the year has gone by? Because some persons will agree with me that while they were growing up, they never heard something like autism, probably ignorance, was the reason for that. But it seems as if as the year goes by, we hear cases of autism becoming more prevalent. So would you say it's an environmental factor or lifestyle or whatever? But what do you think has led to the increase of autism let's say, in the African society today?
And to just add to that, you also speak to if we have database as regarding autistic persons in Nigeria. There's statistics to that.
Yes. Okay, all right. Has the prevalence of autism increased? I would say yes and no. Pardon my not taking a specific side. Yeah, we're making more diagnoses of autism now.
Okay.
We're making more diagnoses of autism now, and it's largely due to improved knowledge, improved awareness. People know now. Once upon a time, some doctors did not even know. We were dealing more with things like malnutrition, malaria, and co, and where we just assumed that this thing called autism is a white man's disease, so we're not even looking for it. But now, with improved knowledge, people now know the signs of autism like we're doing now, and they are making a diagnosis of autism. Also, in the general community, some of those children that you would have said, don't worry, he will talk. Now, because there is increased awareness, people are now coming up to say, oh, my child has this problem, and I don't know if you could do a screening or do an assessment to see if he's autistic. Are there environmental factors? Well, there's a long debate between nature and nurture. Is it a problem of nature, or is it a nurture problem? The truth is, we cannot put it in one box, say this is a biological problem or this is an environmental problem. I think environmental factors would always work hand in hand with genetic factors for it to gain full expression. No wonder autism is in the whole of the spectrum. But for causality, when you say causality, for cause, none of the environmental factors have been proven to be a cause of autism.
Okay. So can it be treated?
Okay, I'll come to that. Let me answer the data question. So we have several data on autism. However, we do not have a national data. Okay. So there are data from Ibadan, data from Benue, data from several authors assessing, and most of them are clinic data. So people are looking at, in the pediatric neurology clinic, what proportion of our patients are autistic. So yes, there are data all over, but we do not have a national data, which is where we should be going to. Can autism be treated? Again, the answer is not a clear yes, neither is it a no. So autism can be managed, and it can be managed to the point where a majority of the features are not obvious or just disappear. Yes, they can. But when you say treated is the concept of you give something, there's a cure, and it's not there again. I like the fact that Frank started with The Good Doctor. The Good Doctor in the movie was still very good, but some of his traits, which he had now learned to manage, were still there, and they come once in a while. That's a traditional story of autism, but they can be helped beyond where they are now, significantly, to the point where it seems like everything has disappeared. Yes.
Okay, so in this case, let's look at the role parents, the society will have to play in enabling an autistic child to grow up and become relevant, to the society generally.
Okay, so first, let me say that the best result in the management of an autistic child is tied to early presentation, early commencement of management plan, and audits. And I think one of the reasons we are struggling in this part of the world is that they are not diagnosed early. From Professor Laguju's work in Ibadan, an autistic child, the diagnosis is probably made after his 4th birthday. Meanwhile, I say to you that in organized climes, somewhere before the 2nd birthday, the diagnosis is already made and management already started. So there will definitely be difference in outcome. So one of the things I think parents can do is, if you think your child is deviating from the typical development of a child, seek medical attention. We are obsessed with listening to other people. We listen to every other person except the doctor. You listen to your neighbor, you listen to the market woman, you listen to pastor, you listen to every other person, but you won't come to the doctor. So I think seek management, especially for communication problem. Your best bet will be somewhere between 2 to 4 years. But that's not to say that you may not get some gains long after, but your best time to get gains in the management of speech and language related problems would be to start early, if as early as 2 years, all well. The other thing parents can do is that, because an autistic child have behavioral problems, I talked about restricted and repetitive patterns of behavior, and they may even have comorbid behavioral disorders. The parents soon turn their frustrations on the child. Either you just neglect the child, or you are beating the child, or something. I think parents also have a responsibility to learn. You need to learn to interpret your child's gesture, because he's having a problem communicating. You need to learn when this is just tantrum, or when this is him calling attention to something that is important to you. For example, they have sensory hypersensitivities. You need to learn, is he calling attention to his sensory hypersensitivity, or he's just throwing a tantrum? We also need to learn to interpret antecedents and behavior at parent level. At community level, I think the biggest thing for community is what we are doing now. We need to talk a lot about it until the stigma drops, until you can tell your neighbor that my son is autistic and he's in a special school.
Yeah.
There are many children who are autistic in clinic, and you are telling them, I would like you to go meet a speech therapist. I would like you to run a session with a speech therapist. And they don't want to. They want to be in a
conventional.
They want to be in an open school. They want to be in an open school. And the open school, the teacher is struggling. The teacher is probably limited in his ability to communicate with a child who is autistic because he's not so trained. But parents are insisting, because once you move your child to what is called a special school, then everybody knows that he has autism, and that shapes. So the community needs to break the stigma. The community at government level, we need to provide enough facilities. For example, how many speech therapists are in Benin City? How many? How many behavioral therapists are in Benin City? How many occupational therapists are so trained to manage sensory hypersensitivities? How many developmental pediatricians or pediatric neurologists do we have in this part of the world? Government needs to encourage people to go into the management of this child. And for the healthcare professional, I think the first thing would be to invite people to take interest in this field of medicine.